We have a number of great folks joining us here. Sorry, there's a little bit of technical difficulty on my end. So today we have Jerrilyn Cambron. She's the president of the Massage Therapy Foundation. Good afternoon, Jerrilyn.
Hello.
Hi. We have Kate Zulaski, executive director of the Commission on Massage Therapy Accreditation. Hello, Kate.
Hi, Deb. Thanks for having us.
And we have Pete Whitridge. He is the president of the Alliance for Massage Therapy Education. Good afternoon, Pete.
Hi, Deb. It's a pleasure to be here. Thank you for having this.
Great. And Leena Guptha, the chair of National Certification Board for Therapeutic Massage and Bodywork. Good afternoon, Leena.
Hello, Deb. It's a pleasure to be here today.
Great. Well, thank you all for joining us. A little bit of an agenda for today, an overview. I'll give you a brief introduction to ACCAHC for those who might not be familiar with our organization, and then we're going to take a whole systems overview of the impact of research literacy across multiple organizations and the massage profession. And then we'll end with a summary and a little bit of review and tell you a little bit about more webinars that are in our series. So for those who might not be familiar with ACCAHC, I wanted to explain a little bit about our organization. ACCAHC is short for the Academic Consortium for Complementary and Alternative Healthcare. We're a broad and multidisciplinary organization with 5 core professions. Those professions include massage therapy, and each of these professions have a programmatic accreditation body that is recognized by the Department of Education. So within our professions is acupuncture and oriental medicine, chiropractic, massage therapy, direct entry, midwifery, naturopathic medicine. So again, we're linked then through those professions to about 375,000 licensed healthcare providers and about 180 accredited institutions and programs in association with traditional world medicine fields such as Ayurvedic, yoga therapy, holistic and integrative medicine organizations. So again, we're a broad and multidisciplinary organization, and what we do is to advocate, convene, and educate to advance integrative health and medicine. And what I mean by that, I'll give you a couple of examples. In terms of advocacy, ACCAHC has been responsible for bringing our professions into national dialogues on integrative pain at the Institute of Medicine and elsewhere, and in research policy at the National Institutes of Health to promote more opportunities to look at our whole practices. In convening, we have co-sponsored an educational conference at Georgetown University in collaboration with more than 50 conventional medical centers. And in education, our everyday work in our own multidisciplinary working groups and task forces, we continue to operate as an example of collaboration across multiple professions. So we say that we collaborate internally to foster collaboration externally. So that's a brief overview. I'll describe a little bit more about how we come to research literacy in just a moment. But without further ado, oops, sorry about that. I did want to introduce our first speaker today, Jerrilyn Cambron. Again, I mentioned that she's the president of the Massage Therapy Foundation. Jerrilyn received her doctorate of chiropractic degree from National University of Health Sciences and received her master's of public health and PhD degrees from the University of Illinois at Chicago. She then completed a certification program in massage therapy at National University of Health Sciences. And Jerrilyn is currently a professor in the Department of Research at National University of Health Sciences and a faculty in the Epidemiology and Biostatistics Division at the School of Public Health at the University of Illinois in Chicago. She has taught numerous research-related courses, including Introduction to Research and Biostatistics, Epidemiology, Public Health, Practice-Based Research, Critical Appraisal of the Literature, and Writing Case Studies. Jerrilyn is also founder and principal investigator of MassageNet.org, and is a strong supporter of massage therapy research in the clinical practice setting. She is involved with the Massage Therapy Research Consortium and currently serves as the president of the Massage Therapy Foundation, also is on the ACCAHC Research Working Group and on the board of the Consortium for Evidence-Informed Practice Educators. So Jerrilyn, welcome.
Thank you so much.
Glad to have you today.
Thanks. So one thing that you had asked me to speak about is why research and evidence-informed practice is important to the Massage Therapy Foundation. And I guess what I really wanted to make sure it's well known is the Massage Therapy Foundation is a not-for-profit organization, and we stand for several different things, and one of them is research and also education and community service. And so when we're trying to make sure that the massage therapy profession knows about research and research literacy, sometimes it's a challenge as to, well, what really does the profession need? And so one of the things that the foundation has done is try and come up with several different programs in order to advance the research. And so we have research grants, we have case report contests for both students and practitioners, we have different ways to learn how to write case reports. We have an online journal that's free full text called IJTMB, International Journal of Therapeutic Massage and Bodywork. We have a research conference. We have a whole bunch of stuff going on for us, and what we're trying to do is really get the word out in terms of research and research literacy for the profession. And so I think, really when we think about how research affects the community and patient care, it really boils down to patient care and making sure that as massage therapists we know, well, what's best for my patient. And so if we think about effectiveness, we can look to the literature as to what types of treatments are the most effective for certain conditions. But we also have to think of side effects and make sure that what we're doing is going to be safe for the clients. Research has lots of other purposes. We also want to make sure that the community knows that there is research behind massage therapy. I think there's been a lot of negative implications about, well, what is massage and what do people do and is there inappropriate touch? But by demonstrating that there is research standing behind certain conditions and massage therapy for certain conditions, it really helps kind of demonstrate what we are all about. And so making sure that the public is aware that this isn't just a profession that hides behind red doors or are out there walking the streets. We are a legitimate profession, and we stand for healthcare, and we're integrated into other healthcare professions, and that we're really here to stay and help people get well.
Great. Well, thank you, Jerrilyn, for that information and the impact that massage has on the community and patient care. So I appreciate that. Was there anything else that you wanted to add today?
There's many different programs that the foundation has, and if any massage therapist wants to get involved in really understanding research and how to read research, we have lots of different programs. We have a Basics of Research Literacy, which is in collaboration with Education and Training Solutions. It's an online webinar where massage therapists can go and kind of learn a little bit more about how do they search the literature, how do they read the literature. Massage therapists can get involved with writing case reports. We have a case report webinar series where if you're not quite sure where to start and how to write a case report, you can go about doing that. We have lots of articles in Massage Today, so if you're not real comfortable with actually reading the full text scientific article, you can read the article in Massage Today to get a little bit easier to read and manage interpretation of the research article. We also have a new podcast series called Research Perch, where we have Nikki Monk, who's one of the editors of IJTMB, and Ruth Werner, our immediate past president, have been kind of just having a friendly conversation about research articles. So there's lots and lots of different ways that massage therapists in the field can kind of get themselves acclimated with what is research, how do I even get started on this, and what can I do with this information.
Great. Okay, well, thanks a lot, Jerrilyn. And we will go ahead and move on to Kate Sawaski, which is our next presenter for today. And Kate is the Executive Director for the Commission on Massage Therapy Accreditation. She has served as Executive Director since 2009. She has in-depth experience both as a massage therapy practitioner as well as an educator, having served as a Dean of Education from 2006 to 2009 for the International Professional School of Bodywork in San Diego. Prior to being named Dean of Education, Kate served as an IPSB massage instructor and clinic supervisor. She is a graduate of Colorado College in Colorado Springs and has also studied a variety of bodywork and modalities encompassing both Eastern and Western paradigms of healing. Kate works closely with the massage and aesthetics organizations as well as the U.S. Department of Education and other accrediting agencies to increase educational quality and professionalism. So welcome, Kate.
Thanks, Deb. I'm glad to have an opportunity to tell people a little bit about the CompTIA standards for research literacy and why those are in there. This is an area of our competencies that is often misunderstood, so I'm really glad we have a chance to just include it in this discussion. The research literacy standards in our competencies really are aimed at making sure that students in their entry-level training are exposed to the idea that massage research has a relevance for all of us, even those who don't necessarily want to do research themselves. Especially just for keeping up with changes in the field and changes in our understanding of how massage can benefit people. It's important that all of our students and then graduates and practitioners are aware of how research may impact them over the lifetime of their career. The CompTIA standards were actually changed around 2002, I believe, to include research literacy in the standards. And one of the biggest misunderstandings that I observe in people thinking that they have to teach research within a CompTIA accredited program is really thinking that they have to go much farther than is necessary. So I want to reassure people that the competencies are aimed at basic exposure, helping students understand why research is important to massage as a profession and helping them be able to find research so that they can read it for themselves. Being able to critically review something and decide, is this from a credible source? And that's really it. Sometimes I see programs that go a little beyond that and ask their students to actually do research. That's a great bonus, but I really want to reassure people that we're looking for exposure and helping people find things and being able to decide if it's a credible source.
Wonderful. Thank you, Kate. I appreciate that explanation in terms of why the competencies have been included and how that can help your graduates keep up and impact them in lifelong learning. Is there anything else that you wanted to add today?
I just wanted to acknowledge that, entry-level training, this is the place where some of our people entering the profession they get exposed to things and they may or may not be exposed to them ever again. So making sure that we include some kind of awareness building for research in that entry-level training is really important to increase the number of people who are involved in massage research, but also able to read it for themselves. Thank you.
Great. Well, thanks a lot. I really like that, that last bit of knowledge that you transferred there, that it's true that what you're exposed to sometimes in your training you may not see again in practice. And so it's important to be exposed to a wide variety of educational opportunities. So I see that we have Pete coming on. I will introduce Pete. Pete Whitridge. He's our next speaker, President, Alliance for Massage Therapy Education. Pete is a faculty member and former director of education for the Florida School of Massage in Gainesville, Florida, past chairman of the Florida Board of Massage Therapy, and past legislative chair for the Florida State Massage Therapy Association. Pete holds a bachelor's degree in history and political science from the University of Colorado. He is a Florida licensed massage therapist with more than 25 years of experience and is an NCB TMB approved CE provider based in Fort Pierce, Florida. So welcome, Pete.
Thank you, Deb, and I so appreciate the conversation today. Really having everyone from the whole system being able to share with the profession the needs for research literacy in our classrooms is so important. I am a classroom teacher. I've been a classroom teacher for many, many years here at the Florida School of Massage and other schools. And also as the president of the Alliance for Massage Therapy Education, we really recognize that much of the new information in the sciences of massage and manual therapies isn't always getting out into the field to the classrooms. Many students are learning old methods and information that may or may not be as current as possible. So I teach with the Massage Therapy Foundation a teaching research literacy class for teachers around the country, and it's pretty amazing to me how our teachers really need to step up their game a little bit to be able to deliver some of this new information for our students. The AMTA just had a conference, and they had some wonderful research papers and posters and presentations, and the crowds are getting bigger and bigger and bigger to attend those classes. Uh, Being literate in massage research means that you're able to look something up, but it also means that you're able to look for flaws, decide if the methodology is really able to be replicated, and many times it's helpful for students and therapists to have access to findings about what the methodologies are. That's why the Massage Therapy Foundation is such a wonderful research resource. Um, Patient care is affected by therapist knowledge, and many, many times we hear about people who are not having effective treatment, and thus maybe the therapist is choosing a methodology that doesn't quite serve the condition. Um, the Alliance is a group of educators, CE providers, school owners that's very focused on helping teachers have professional development that really serves the profession. If you're a CE provider, we want to help people be teaching the most accurate and current information about fascia or methodologies for assessments. And one of the great things about the Alliance is we're in relationship with all of the groups that are here on the webinar today, plus the licensing boards. Within the classroom, it's so important for students to have educators that can help them really digest and think about some of the implications of what their manual therapies are. I have a couple of books that I want to recommend from this webinar, and we're going to have a series, so I hope that people will begin to reference these throughout the series. Christopher Moyer has a fabulous book out regarding massage therapy research and findings. This is a tremendous resource for any classroom. Of course, prior to that book coming out, one of the ones that we used to spend a lot of time with is the Neuromuscular Techniques from Leon Chatow. These are well-referenced books, well-documented books, and help therapists begin to be more critical thinkers. Just this morning, I got my new copy of the Chatow's new book called Fascial Dysfunction, and this is a summary of a tremendous number of research articles and experiences from the research, the fascia research congresses and various pain conferences, and gives a lot of synopsis. So I'm going to highly recommend that if people want to be teachers or educators or students of the field, they start to pick up this particular book. Well documented, gives tremendous resources for people to reference, and when someone uses this book for client choice and technique choice, they'll be going down a road of evidence-informed practice. The only other book that I want to just kind of put up here is actually from Dr. Robert Schleip, and this book, Fascia, the Tensional Network of the Human Body, is another very scientifically based book and very well organized for educators and members of the field. This is the kind of information that people truly need to be successful and effective practitioners. There tends to be a lot of mythology and magical thinking in massage sometimes. This brings it right down into the physiology. This is really what we're talking about here as we go through this series of webinars. I guess, Deb, the last thing I just want to remind everybody who's listening is that research literacy is wonderful, but also in our field we need to start to develop research capacity where our schools are actually having clinics that are collecting data and information and helping the students see the effects of the work that they're doing immediately by keeping blood pressure, pulse. Some schools that I've encouraged have nurses who come in and take not just blood pressure, but urine, blood, all of those things, so we can actually have some statistical data and help inform the public and begin to look at what kinds of conditions really benefit from what kinds of massage. So I could speak a lot, and I only have 5 minutes. What I would say to you is, as a practitioner and the president of the Alliance for Massage Therapy Education, research methodologies in the field are just developing. People who are very smart, who want to continue their career path, can easily begin to incorporate some scientific methodology into their practices and begin to help build the base of evidence for massage. Jerrilyn and I are working with the Department of Defense on a study with the Samueli Institute on pain in the military. There are all kinds of areas that we need to help our populations feel better, enjoy the qualities of their lives, and have results from therapeutic touch.
Great. Well, thank you, Pete, for all the information and the wonderful references to the various texts that you have there. I especially liked your comment on patient care is affected by your therapist knowledge, and that starts with your educators. Is there anything else that you wanted to add today?
No, I think it's been a pleasure to be here and to work with the 5 of you, and I'm going to turn my camera off now.
Thank you so much for joining us. We'll click through, and we finally we have Leena Guptha, who is the chair of the National Certification Board for Therapeutic Massage and Bodywork. Leena received her degree in osteopathic medicine from the British College of Osteopathic Medicine, a master's in complementary therapy from the University of Westminster, and graduated from the British College of Acupuncture with a license in acupuncture. She is a board-certified hypnotherapist and graduated with honors as valedictorian from her Master's in Business Administration program. She was formerly the Dean of Massage Therapy at Lay College in Pennsylvania and is taught at the University of Bridgeport College of Naturopathic Medicine and National University of Health Sciences. Leena is passionate about advancing education, securing regulation, and facilitating the integrative medicine profession at large, moving towards global recognition. She is a board certified in therapeutic massage and bodywork and is an NCB/TMB approved provider. She dedicates her time to promoting and teaching ethics, research, musculoskeletal alignment techniques, and business practices, and practices in a family medicine clinic as part of a collaborative healthcare team. Her professional career spans more than 20 years and has encompassed primary care, academic appointments, and the practice of natural therapies. Welcome, Leena.
Thank you, Deb. I would like to thank you and ACCAHC for putting this webinar together and bringing us all like minds together to discuss our common interest in research.
We're very glad to have you. Thank you.
I think a lot of people want to know why did the National Certification Board move to include research literacy and research education into board certification. So I will address that question first. When moving from national certification in therapeutic massage and bodywork, which was an entry-level credential, to an advanced credential of board certification in massage therapy and bodywork, we had the opportunity to look at what are really the requirements that we place on massage therapists. And for years, we mandated ethics as a requirement. And in thinking in terms of both paralleling other professions, but also what area would distinguish an advanced practitioner from an entry-level practitioner. Research became the common thread. Apart from the fact that research literacy and research itself is a cornerstone of many other healthcare professions. So we rolled out the initial board certification in therapeutic massage and bodywork last year, and that's in a 2-year cycle. The first group of massage therapists who will then recertify will be in 2015. And it's in 2015 and onwards that we will be requiring the 3 hours of research education, which can include a number of the methods that Jerrilyn mentioned right in the beginning, but we're also working very closely with the foundation to get the word out on how practitioners who maybe don't have a research background, perhaps they didn't study it in their original program, or various ways that they can get involved with research and accrue those 3 hours of continuing education.
Wonderful. So you had mentioned that research really distinguishes an advanced practitioner and also is consistent with other professions. Was there anything else that you wanted to add today?
Well, in truth, my belief is that any practitioner, whether they're entry-level or advanced, can participate in a research study or learn how to read an article or do the case reports and many of the things the foundation already provides and is working to advance. In terms of the relationship between research and board certification, as massage therapists get more recognized in integrative healthcare practices, medical venues, there are multidisciplinary practices, also spas that are looking to advance the credentialing of their lead therapists. Research seems to be a very important part so that a practitioner can discuss either with their patient or their client or allied health professionals as well as medical health professionals what is actually the efficacy of research and in which areas we can show that massage therapy has been shown and validated to be effective. So all of that kind of speaks to why research is important as a requirement for those who are renewing their board certification. If we look a step further from the individual massage therapist, and I like the fact that Pete mentioned very smart people and career path. I like these two concepts, and the career path part, though we all strive to be very smart for sure, is where board certification fits in educationally. But if we go beyond that advancement into the profession at large, being more familiar with research literacy and understanding research advances us as a profession in terms of both our knowledge and training, and really parallels what happens in medicine in terms of not only we see board certified practitioners, which can be a voluntary credential, a means of validating advanced practitioner in terms of their skills and competencies. So the profession at large can advance through being more educated in research, more educated in their training and continuing education, and also in holding the highest certification credential that we currently have within the profession. So those are my thoughts of the day.
Perfect, perfect. Excellent thoughts, all. And is there anything else that you wanted to add today before we move on?
I think those cover the main points. That how does research impact the individual, and how does it impact the profession, or the spectrum of the things that all of us are interested in advancing on this through this webinar and through many other similar activities.
Perfect. Well, thank you so much for joining us today. For those who are on the webinar, I did want to mention everybody is on mute. If you have questions, please go ahead and type them in, and we will get to those questions at the end of the webinar. So our panelists will be staying with us to answer questions towards the end, so please do keep them coming, and we will get to them. So with that, I would like to go ahead and introduce myself. Again, my name is Deb Hill, and I am with the Academic Consortium for Complementary and Alternative Healthcare, currently serving as the project manager for PERL. And I wanted to present a bit about the ACCAHC perspective in terms of how we look at this in the broader integrative healthcare environment. And as I'd mentioned previously, ACCAHC encompasses a multidisciplinary, multi-professional organization. And is an academic consortium, so we look towards competency-based learning. And in 2010, ACCAHC developed competencies for optimal practice in integrative environments. We developed a set of 6 competencies, evidence-based healthcare being one, which I'll get to in a minute. But I did want to mention that this largely, well, first of all, this had broad approval from the board of ACCAHC across multiple organizations and multiple professions that these competencies would be important for an integrative healthcare environment that is collaborative and inclusive of all healthcare disciplines. So there's 6 fields, and these largely parallel with a initiative within the conventional medicine side in terms of the Interprofessional Education Collaborative, and that is a set of 6 organizations in conventional medicine, all looking towards how do we produce interprofessional and collaborative practice. So these competencies then overlap between 6 conventional medicine organizations as well as the 5 core professions that are represented by ACCAHC. So it is broad and it is encompassing. So moving on from that, there is a competency, as I just mentioned on the last slide, that ACCAHC developed surrounding evidence-informed practice and evidence-based healthcare. And I did want to explain just a little bit about that in that this is used, this is the core support for a project to enhance research literacy, is to support this competency. And when we talk about evidence-informed practice, we not only talk about moving research into practice, but it is 3 parts. So it's using and moving research into practice to inform your clinical decision-making, but also, as important, will be your practitioner experience as well as your patient preferences. So this is really a 3-part process, and it starts with research literacy. So we have developed at ACCAHC, the Center for Optimal Integration, a web-based portal that helps to support, again, the resources developed to support these competencies that we have we've seen across the board here. So this is a web-based platform, and it's open to anybody with a stake in integrative health, and that would be all of you on the call today, as massage therapists, as integrative healthcare practitioners. This is a priority project to advance interprofessional collaborative healthcare moving forward. So this, the project to enhance research literacy, as I mentioned, supports that competency in terms of evidence-informed practice. And you're welcome to visit us at optimalintegration.org for the resources that are available through that project. But I did just want to give you a brief overview of what PERL is. And again, this is a multi-discipline, interprofessional collaborative effort. There were 7 ACCAHC member institutions that have received federal funding to enhance research literacy and to infuse evidence-informed practice throughout their curricula. The resources that were developed during the course of those programs through that funding are shared with us, and they are presented in the web portal that I just showed you. And so we utilize these resources then as a platform to engage the conversation around shifting the culture towards evidence-informed practice and research literacy. And again, that is the goal to support our competencies that we developed. Our investment partners largely are, PERL is funded through the Josiah Macy Jr. Foundation. We do have other wonderful investment partners, notably the Massage Therapy Foundation as well as Massage Envy. So with that, I wanted to briefly summarize today what we reviewed on our webinar. We started with Jerrilyn, who summarized some of the wonderful programs that the Massage Therapy Foundation has developed to really advance research literacy, to let us know about those resources that are available, and how research literacy can really help facilitate community awareness and in terms of what massage can do for the community. Then we moved on to Kate, who told us a little bit about why COMSA has included the research into the accreditation standards. Also letting us, bringing up the concept of entry-level training is really where you can be exposed to research literacy, and it's important to have that in the entry-level training. We moved on to Pete, who introduced us to a number of great resources and how this impacts educators, and that massage therapist knowledge impacts patient care, and that starts with education. And then we moved into Leena, and really why is research included in the new board certification, and that research is really important in terms of continued career path development, and also important for interprofessional collaboration, which ties beautifully into what we just mentioned for ACCAHC. So that's just kind of a rundown of what we've covered today. I did want to mention that we do have more webinars in the series. The next one will be Tuesday, October 14th, and we'll take a look at examples from the field, everyday use of research and practice. We have 3 wonderful speakers that will be joining us. That is Clint Chandler, Bodie Harrelson, and also Martha Menard. So stay tuned for that. Feel free to go ahead and register on our optimalintegration.org website. And with that, I did want to thank you and go ahead and open this up to questions. And thank you for your attendance. So Jennifer, my colleague Jennifer is on the line. Did you have any questions that had come across?
Yes, hi everyone. We did have a few from the audience requesting a list of the references that Pete mentioned. I did send them in through the chat feature, so we do have those available. We'll also get those out another way. We also had one question from our audience today that I think was very useful. I'm going to go ahead and read it. It says, I'm interested to know how a massage practitioner who doesn't have much personal intrinsic interest in research can find a way into research literacy and evidence-informed choices. When I hear the background of the presenters today, I have a hard time relating all that history to someone with a basic massage education and a healthy massage practice. And if we could respond to that, that would be a great way to kick us off. Good question.
That is an excellent question. And I'm going to go ahead and put that right back out to our panelists. We have 4 wonderful individuals from many organizations that have, as our question indicated, have a great background in this. But how do we begin from the beginning? I'll leave that out. Leena, Jerrilyn?
Sure. This is Jerrilyn. I'm happy to answer that. You know, when you think about when you first started massage therapy school, you probably didn't know all of the names of the muscles and the attachments and the insertions, and it was a brand new language at that time, and it took a while to really understand what does this mean, what does that mean. And I guess I think of research the same way, where when somebody first picks up a research article, it's overwhelming with statistics and terms like randomization and blinding and stratification and all of those technical words, but you know, really I just want to say you have to just keep practicing, and there's a few things that you can do to kind of get yourself prepared for it, and one of them is there's several different courses that you can take to get a little bit better. One is sponsored by the Massage Therapy Foundation, and I had talked about it. It's an online class called Basics of Research Literacy, and it's a self-paced class to learn how to actually read and understand the literature. But one of the other things that you can do is read some of the articles that come out in Massage Today about research articles, and then try and read the research article yourself and see, are you getting the same thing out of it that somebody who's talking about the article is also getting out of it. You can also have what's called journal clubs, which are just like book clubs, where you get together with a few other individuals, you all read the same article, and then you talk about that article. And so IJTMB is the scientific journal that I talked about before that is free online. You can decide that the next time an issue comes out, you and your group will pick an article, and then you sit down and talk about it and try and try and really understand what is this saying, what are the implications for practice of that. And if you really get stuck, you know, you can reach out to any one of us and ask us, you know, what does this mean, what does that mean? Because, you know, really what all of our organizations are about is trying to help you as a massage therapist out there in the field really understand what's going on. And I know the foundation is very interested in making sure that massage therapists feel as though they have the resources that they need for basic research literacy.
Very good, thank you. We do have another question. How do we access the web-based portal?
The web-based portal that we spoke of for ACCAHC actually can be accessed through what's on your screen right now, which is www.optimalintegration.org. And under there, you'll find a list of our projects, which is PERL. And so in there, actually, and I'll piggyback on Jerrilyn's comment here too, there's the set of resources in there is developed and into different levels of understanding. So if you're just getting started and aren't certain about evidence-informed practice, you would enter underneath the Getting Started area. And under there, there's some free tutorials in terms of what is evidence-informed practice, if you want to take a look at that, some research methodology, some statistics. Depends on what exactly and how, you know, you can pace yourself with the online tutorials. So hopefully that will be of help. And then also if you have any questions at all too, feel free to contact us at info@optimalintegration.org, which is also on your screen. We'll be happy to go ahead and answer those questions and see where we can go from there.
Great, thanks, Deb. We do have several questions coming in. The next one, let's see. It's Lisa poses this question. She asks, I'm notified of new PubMed articles on massage, but of course they are not full text. It would be useful if one of the groups out there would keep a list of massage research articles listing the strengths and weaknesses of the research conducted.
Excellent question. I open this back up to our panelists. And would one of you like to take this?
Yeah, this is Pete. I'd love to address that a little bit. One of the things that is very frustrating for anyone who is not affiliated with any kind of institution or large medical library is actual access to the full text articles. I think it would be incumbent upon our Federation of State Massage Therapy Boards and maybe even some of our certification boards to maybe have some kind of institutional access for the field. Janet Kahn and I talked about this a long time ago at Harvard Medical School when we had the first research congress, and you know, maybe it's time now that we start to look at not just what is open access, which I think is very important, Public Library of Science, Cochrane reviews, but also there are things within our field that maybe our organizations can make some kind of portal for massage therapists to be able to have access. My brother happens to be a clinical dietitian, and he has many journals that are available to him through interlibrary loan or internet sharing relationships with other medical schools. As a field, I think that's one of our issues, is we don't have a lot of access to materials.
Thank you, Pete. That is definitely something that we've identified within ACCAHC and our project to enhance research literacy, and are actively looking at ways to help address that. So we're aware of it, and we'll continue to work on it. Jennifer, was there another question that came in?
Yes, we have several more questions. This next one is from Nancy. She asks, do you see more doctors in the medical community writing prescriptions for massage for HSA and MSA accounts? This is important.
Excellent question. I'm going to open that up to our panelists. Did anyone want to take that?
I'll take that. I think that we can see definitely trends in massage therapy in terms of the integration of massage therapists into primary care settings, and in those settings facilitating the insurance reimbursement is in some cases easier. If we look at the evolution of many of the healthcare professions over time, the issues that we struggle with today become our evolution. So as we get closer with the medical profession and have supporters of key institutions, that as well as this research component actually becomes even more critical in terms of validating what we do and what we know, but we would want to move to what we can prove, then that insurance reimbursement and the evaluation of the CPT codes, as well as the methods on which these CPT codes will actually roll out in the next phase from 2016 onwards, I will anticipate that reimbursement for massage therapy will become less cumbersome.
Wonderful. Thank you, Leena. Jennifer, did we have another question?
Yes. The next question. What are the
Jennifer? I think we lost her.
Did you hear me? Can you hear me now?
Try again. Yep, I can hear you now.
Great. The next question. What are the CompTIA standards for research?
Faith?
Okay, so within the CompTIA standards, we refer to things by their numbered standards, and currently the competencies for the curriculum are within standard 2.10. The research literacy standard is at the end of the competencies under competency number 6, and it's element 6.3. So it's actually a pretty simple section. The first item, there are 3 items. The first one is explain the value of research to the profession. Number 2 is identify sources of research literature on therapeutic massage and bodywork. And the third is critically read and evaluate a published research article in the field of massage therapy and bodywork. So like I mentioned before, it's really about basic exposure and being able to find credible resources for research and being able to evaluate that. I also was remembering that the original group that I was involved in about 10 years ago, the Massage Therapy Research Consortium, Pete mentioned that part of the importance of including research is to build research capacity. About 10 years ago, we were talking a lot about the fact that most of the research that was available on massage therapy did not include any massage therapists in the actual studies. So the massage itself was being done by nurses, physical therapists, and other people. And part of our efforts were to increase the awareness and understanding of massage research so that we could shift that and really have massage therapists being involved in research studies more directly. And I'm so proud to see how far we've come in the last 10 years.
And I'd like to dovetail on that with Kate. The ability for schools and educators, whether they're CE providers or entry-level programs, to latch a hold of this and really help the students at the very basic level to say, well, we're doing Swedish massage here. This includes these strokes, and these are the intentions. And yes, indeed, there is some research or very little research about the effects or the effectiveness of this, and we'd love for you to start to think critically about this, because some of our students come out of the college university systems, from the STEM systems, and they are really excited to try to study what they're wanting to practice for the rest of their lives. And that curiosity, that lifelong curiosity, is really what we are trying to spark here in the PERL project. I personally have a variety of studies that I would love to see us accomplish, and there's the inability because of money or funding or time, that people put those aside. And as a field, I think it's incumbent upon us to work with ACCAHC, work with the research educational institutions, and learn from those groups so that we can actually have interprofessional relationships and the ability to attract people who are nurses, physical therapists, other healthcare providers to help us in the studies. The massage therapist has one role, the statistician has another role, the person who actually is involved with the ethics and review of that has another role. So it's really a team, and that's what Kate's talking about.
Thank you, Pete. That is wonderful, wonderful, and I like that we're all working together here, and definitely that's an interprofessional view, which ACCAHC supports fully. Jennifer, was there another question that came in?
We did have one request for the website of the online training Jerrilyn mentioned.
If you go to the Massage Therapy Foundation and look under our education section, you'll see research literacy courses. And you can get to the, there's actually 2 different online courses that we talk about. One is for 3 hours and one is 6 hours. And so again, massagetherapyfoundation.org, click on the education button, and you'll see research literacy courses. Click on that.
Great, thank you.
Mm-hmm.
Jennifer,
Thanks.
Did you have... There's another,
yes,
more
there are another few more questions. This next one, are there any annual conferences where students can present research performed in class?
Great question. So Jerrilyn just came back from AMTA. Maybe we'll let her address this.
Sure. If they would like to present at AMTA, there's a couple of different ways. One is doing a presentation out loud at our research panel and talking in front of an audience about what type of research they did and what their findings were. The other way to present at a conference like AMTA is through posters. The poster sessions, you have to submit an abstract, and then the scientific review committee goes through and reads the abstract and sees if this is eligible for presentation. One thing I just want to make sure that anyone who's interested in doing research is aware of, if you plan on doing research that involves human subjects, you need to be real careful about having an ethics board or an institutional review board, an IRB. We never want to have any ethical concerns with the research that we do, and I just want to make sure that you're aware of that, so make sure that you talk to your teachers and the people in charge of your school about the ethics issue before you start doing any research.
Great, thank you.
Mm-hmm.
I'm looking at our time, and I think we might have time for maybe one more question. We're running up towards the end of our time here. Jennifer, was there one more?
This last one, and this would be a good question that kind of dovetails into a question that was posed earlier. It's a comment that says, I personally feel pretty comfortable with research. I am more thinking about our graduates out in the world, maybe even the ones who went to school before research literacy was such a hot issue. Even recent grads and current students often seem overwhelmed and uninterested as soon as the word research comes into play.
I'm going to leave this out to our panelists to comment, and we'll finish out. This is a great question to finish out the webinar with. So who would like to start?
Well, I'll take a shot if you all don't mind. This is Pete Whitridge, and there's a tremendous amount of information that we can take back to our clinical space, our practice room, and sometimes it has to do with direction of push or oscillation within the tissue, and I think that when someone thinks about research and says, oh, that seems so scientific, that's a cultural issue for us. Within our world, there are lots and lots of things that are studied scientifically and with data, but also use qualitative information to also augment that information. So it's not dry, it's something that can be applied directly in our classroom, in our clinical space. The book that just came out from Dr. Chetow, Fascial Dysfunction, is a wonderful summary of all of the fascia research that we've been seeing since 2007. It's very accessible. Maybe it will help people have more longevity when they're more curious about what it is that they're actually working on. After all, this is a human body with spirit in it and with breathing and physiology in it, and we have interreactions and interactions and reactions with people we're working with. And to me, since it's such a living whole system, wouldn't it be nice to know a little bit more about it in a scientific or curious way? It's sexy. You should become research literate.
Wonderful. Well, thank you for that comment. I'm going to dovetail on that a bit in terms of, I think that our question had asked about being overwhelmed when it comes to research. And we'll have more webinars in our series in terms of what is evidence-informed practice. But the process of evidence-informed practice takes you through a search process to more easily locate the research that would be most applicable to the clinical question that you have at hand. So in that respect, it's a way to help you, to keep you from becoming overwhelmed with the amount of research that's available and try to narrow it into something that's more applicable to the patient that you see in front of you. So I wanted to put that out there, and I'll give our rest of the panelists one more go around and see if there was any other last feedback before we close up the session.
This is Kate. I just wanted to acknowledge that exact situation, feeling a little overwhelmed and not sure how to access research in an easy kind of how do you integrate it into your way, into your life way. That was part of the discussion about creating these webinars, and I'm really looking forward to the future sessions. I'm also excited about the Research Perch podcast that the Massage Therapy Foundation recently started, so I'm going to go investigate that myself.
Well, Kate, this is Jerrilyn. I'm glad that you mentioned that again. You know, it's a podcast is just a little 20-minute video and or audio bit where, and with our Research Perch, it's a very conversational way to enter this world of research. It's two people kind of talking about an article, and if you're really feeling unsure, how do I start this, what do I do? If you even have 20 minutes of time just to listen to one of these, it might help you get a little bit more excited about research and research literacy.
And Jerrilyn, I dovetail on that, and then I'll defer to Leena to finish. The ability for you to access public information from the Public Library of Science or the Cochrane Reviews is a very wonderful way to start. Many of your clients are actually accessing those things themselves when they come in. They've got medical problems or some kind of diagnosis, and they're looking to us for solutions and help. And many times soft tissue, musculoskeletal pain is the biggest issue that helps then people be able to have less anxiety or to sleep better or to feel as if they are able to inhabit their body a little bit differently. So I think this series is going to be a good jumping point for us. Deb, I so appreciate the ability that we will be able to access in the future, and anything that the Alliance can do to help support what ACCAHC is doing, I am available.
Thank you so much, Pete. Leena, did you want to make a few comments before we close out here?
I think just that in our profession we have so much diversity both in education, background, and modalities of practice that first of all we have to recognize that that's who we are. We serve an incredibly broad spectrum of practitioners as well as educators, and that research is one strategy that where we can all collectively advance as a profession and capitalize on that diversity and serve the profession at large both internally in terms of our stakeholders, but externally in terms of our recognition. So I think this cornerstone of our profession is something that we need to continue to focus on, advocate for, and publicize so that we bring more and more people into the fold and maybe change that the mindset. And to be honest, I think the mindset of those who may not be overly excited about research is not from doing research and then deciding it's not for them. I think it's incumbent in all of us to be able to provide that education so that people can make a knowledge-based decision research rather than one based on the absence of this experience.
Thank you, Leena. Well, I want to thank all of our panelists today. We've had some great discussion here. I hope that everybody walks away a little bit more excited about research, and also excited to join our next webinar in the series, which will address some of the questions that were brought up today. Examples from the field, everyday use of research and practice. And we'll be taking a look at, basically tips from the front lines of how to keep current with research and how to put research into practice. So I thank you again for your attendance. Please, if you have any questions, feel free to contact us at info@optimalintegration.org. And thanks again to all of our panelists. Have a great day.
Thank you, Deb.
Thank you.
Thank you.
Bye.
Bye-bye.